Hi, my name is Damien Stevens Todd. I identify as a gay man and my pronouns are he, him and his.
My name is Chris Stevens Todd. I identify as gay as well and my pronouns is him and his.
My name is Eideann. My pronouns are they, them, and I identify as a lesbian.
Hi, my name is Emmett. My pronouns are he, him, and I identify as a transgender male and a pansexual.
So I'm James. My pronouns are he and his, and I'm a paramedic and identify as gay.
So my name's Kelley. I identify as lesbian. My pronouns are she and her.
Hi, I'm Kian. I'm trans, gender fluid, non-binary. I'm also asexual and, broadly speaking, just queer. My pronouns are they, them, their.
Hello, my name is Liam Bugsy. My pronouns are he, they, and I identify as ace arrow.
Hi, I'm Belinda. My pronouns are she, her, and I identify as a lesbian.
Hi, my name's Renee. I identify as a lesbian and my pronoun is she, her.
Hi, my name's Paula. My pronouns are she, her, hers. I identify as pansexual.
Hi, my name's Xander. My pronouns are they, them, and I'm queer.
Lesbian is someone who is female and attracted to other women.
Lesbian is someone who identifies as a woman who is attracted to other women.
So gay for me is like a man who likes other men, and more so exclusively men who like other men. That's right. Obviously, when we were growing up, there wasn't such a big spectrum, and so the word gay was quite generalised.
I am pansexual, and to me, pansexuality is being attracted to the person themselves rather than gender. Transgender is identifying as something other than the sex you were assigned at birth.
So queer for me is better to describe myself, just because I don't feel like my gender identity or my sexuality can just be tied up in binaries. So queer just kind of is an all cover for everything and doesn't limit my identity or my sexuality into I'm just attracted to men or I'm just attracted to women, or it's broader to encompass it all.
Queer is just a good umbrella term. It sort of encompasses everything without having to go through all of these explanations. And yeah, it's great. It covers everything.
I sort of explain it to my colleagues as, well, it's commonly used amongst younger generation LGBTIQ. For the older generation, it can still be quite offensive. So we've just got to be mindful in the way that we use the word queer, and let people self-identify with it rather than putting that label on someone else.
Excellent. While queer is an umbrella term, it's not a compulsory term, it's not a term that everyone identifies with. So a lot of people within the LGBTI+ community are not queer. It is not something that everyone is. It's something that you identify with or you don't.
Ace, standing for asexual, means someone doesn't desire or experience sexual attraction for people. And arrow, aromantic, is someone who doesn't desire or experience romantic attraction or want experiences of that nature with people.
The asexuality, I do not experience sexual attraction. There is again a big range of asexuality. There's sex repulsed all the way to sex favourable. I personally am sex averse, which means I do not have any interest to engage in sexual activities. I won't do it.
So cisgendered is that your gender is the same as what you were assigned at birth. So there's sort of two little acronyms of AFAB and AMAB, which is assigned female at birth and assigned male at birth. And if that lines up with how you identify, then you're cisgendered.
Yeah, transgender is when your inside doesn't reflect your outside. Cisgender is when your outside does match your inside.
And heterosexual is someone who is attracted to the opposite gender.
What are pronouns? Pronouns are words we use to identify ourselves. So for me, obviously I'm they, them because I don't identify as male or female. Some people will use all the pronouns, whether it be they, he, she, and some will use obviously the binary pronouns of she and he.
Some pronouns are she, her, they, them, he, him, z, zer, with either an X or a Z. They may go just by their name itself.
Pronouns are generally words that other people use when talking about you. So if I'm talking about someone who goes by she, her pronouns, I'd be like, oh, she did this on the weekend, and her family has 3 dogs. Something like that. So you use it when talking about other people, but the way that you talk about other people, you tend to use their name. So say her name is Sarah, you would call her Sarah. And you use the name, and everybody has a different name, and some people have different pronouns as well. So some people, they might be called Sarah, and they may go by they, them pronouns instead. And so the same way that you can use someone's name to refer to them, you can also use their pronouns.
Neo-pronouns are new personal pronouns. So for me, they are they, them, their. There's also a whole bunch of other ones, they, fear. I'm not actually certain on the pronunciation of those. I've mostly just encountered them online. So I've seen them written, but I haven't really heard them said as much. And then there's a lot of other different neo-pronouns. Air is a big one as well. But yeah, they serve a lot of different purposes. They do not denote gender. So they do not, like they, them, their is not for a specific gender. This is not the gender fluid pronoun. It's just my gender fluid pronoun. As I mentioned earlier, it just feels too gender neutral for me. No part of me is gender neutral. So I ended up going with they, them, their just because they're pretty easy. They are the they, them, their pronouns just with a Z instead of a TH to sort of add a little bit of gender chaos instead of gender neutrality. And people of all sorts of different genders will use neo-pronouns to just express their gender a little bit better for them.
I guess to me, gender is the way that someone chooses to identify and to express themselves. So some people tend to lump sex and gender into the same thing. So the sex that you were assigned at birth is kind of set in stone, but it doesn't have to be. And so there's sort of 2 different ideas of sex and gender. And gender, you can identify anything on the spectrum essentially. So there's male and there's female and there's these other lovely rainbow things in the middle.
It's just who you feel and know that you are, regardless of what the outside reflects. But it could also even just be what the outside reflects. It doesn't matter, it's just what you are.
Gender just means who I am. It's just from the core.
Gender is, for me, fun. It's something I get to experience differently on different days, that I get to play with the expression of, and I get to really explore every day what gender means to me and what does my current gender mean to me and how do I want to express that and present that to the world.
Gender for me is confusing. I always say to people, and I have to wonder if it's a bit of an autistic thing or something, because gender just makes no sense to me at all. It's just bizarre. This concept of you are female or you were born with these particular genitals, so you have to act like this, and it just in my head makes no sense.
So gender expression is how you express your gender. So everyone has ways that they express their gender, and it doesn't mean that that is your gender. So you can have a man who wears makeup every day and wears frilly dresses and gets married and wears a gorgeous white wedding dress and a veil and still be a man. And you can have a woman who would literally never put on a dress. Last time she wore a dress was when she was like 2 years old because she wasn't yet able to fight strong enough to get away from it and still be a woman.
But you don't have to look a certain way really to be any certain gender.
For me, I'm physically disabled, and so I see a lot of doctors, and the funniest misconceptions around my gender come from medical personnel. So there's smaller times, like the time I had to do a urine test, and the nurse handed me this little alcohol swab to clean the tip of my penis with, in order to not have the urine sample contaminated. And I'm like, I don't have one of those. I don't actually have that. Why did you just assume I had a penis just because I said I was trans? That's confusing. All the way to a different doctor who gave me medical advice that I only happened to realise towards the end because of a throwaway comment he made was actually pretty dangerous advice, because he assumed that I was assigned male at birth, because that's what trans people are, like assigned male at birth. And so he gave me this medication, said that it was fine at it, and then he made some throwaway comment about how it was an issue for women on birth control because it stops it being effective birth control. But he wasn't going to tell me that because he assumed that I didn't need it for that. Which, I mean, I'm asexual, so I actually didn't need it for that. But he didn't know that part! And so you get a lot of assumptions around that, around being trans means that you were assigned male at birth. It doesn't. You can be assigned anything at birth and be trans, you just don't identify with what you were assigned at birth, that's it. If they'd asked the right questions, it certainly would have helped, and also not made the assumptions to begin with.
Like, all of my symptoms were just completely pushed aside, saying, no, this is just pregnancy. Like, they assumed that I was pregnant, and they were like, you should have a pregnancy test. And I was like, no, you don't understand. Not only am I a virgin, but I am not active, and I am, like, you know, queer, so, like, the chances are not there. And they just were like, that's ridiculous, take, like, pee on this. Completely ignored it. I think he actually got more aggressive about it when I insisted that I was not an individual that had sex with men as well. So, yeah, there was a very obvious moment where it went from, you know, kind of dismissive to aggressively dismissive. Yeah.
It's definitely a barrier to healthcare when the very first thing you do is you go into an ED, you have a form, say it's an ED you've never been into, you get given a form and the first box on it is male or female. And there's 2 boxes and it's very clearly very binary and you have to tick one or the other. And if you don't fit in those, it's a lot of scribbling and explaining and it's not particularly easy. So just having a 3rd box or a section where you can write your gender makes it a lot easier.
Now I think about it, the main area is forms and paperwork. They just don't have the boxes for, you know, it's fine, like I can tick the boxes that I identify to because they're always there, but it's the other people that may identify as them and they, or people that are trans, intersex, their boxes don't fit for them.
I get misgendered at work daily. Like, it's obviously most patients don't know what non-gendered pronouns are. Most of the people that we're dealing with are over 50, over 60, so they don't really have much of a concept of what pronouns other than the binary pronouns are. I just let people gender identify me as ever they feel like. When I was working on the wards, I remember I looked after one lady who had read me as male, so was using male pronouns for me, but then her husband had read me as female and was using female pronouns for me. So, and they were both sitting next to each other. So that was a really interesting kind of conversation. And yeah, because she was just like, oh, you're such a lovely boy, thank you so much for looking after me. And then he was saying something else and would use she, and it amused me greatly.
I actually don't use my correct pronouns in rural medical settings because I know it will not go over well. So I introduce myself as I use they them pronouns. It's not true. I don't particularly feel comfortable with they them pronouns. They're okay, but they are not my pronouns. They are not the right pronouns. But they're better than having the entire $500 medical appointment being spent having to explain what neo-pronouns are, why I use these pronouns, what trans is, which I'm already going to have to spend half the appointment doing, and then half the appointment's just going to be explaining all of my different diagnoses, so pretty much we don't have any time to actually get any kind of medical help. And when you throw in neo-pronouns as well, it's all too much having to explain and justify, and they'll be getting defensive and they will not use them anyway, so the whole conversation's pointless. It's hard enough getting medical practitioners to use they them pronouns, and that's even in cities you can't get them to use those very well. In regional settings it's really hard. They do not use the right pronouns. A lot of them try. My GP tries. She's actually quite good. She's discussed with me, so I'm writing this referral to this specialist. It's about this. How would you like me to refer to you in this, considering these reasons? The medication protocol that they will likely recommend will be different based on whether you have a uterus or not. And so that matters, actually explaining gender in that context, and she'll actually explain to me why it matters in this particular context, and she'll talk about it with me, and that's fantastic. Most do not. I've worked very hard to find a GP who does.
I think for 20 years now it feels like I've repeatedly had to educate people. I didn't mind, but now I'm just old. I'm 41. I want to just go to the doctor and not have to educate a doctor, a counsellor, a nurse, anybody about LGBTI before I just get damn good healthcare. It's that simple.
Yeah, I'm frequently the educator for medical personnel in particular, but across the board a lot of the time, which is a role that I've chosen for myself, to be an educator. I have my own little website where I run a little blog which informs people about different aspects of being trans, being disabled, being neurodivergent, all of the different aspects that make me up into who I am. But it gets exhausting, and when I'm in hospital, barely able to talk, unable to remember the diagnosed conditions that I've had for over a decade, I can't remember the medications I'm on, and doctors want to know about my transgender journey and my history with that, and whether my family accept me, and I don't know at that time. I'm in so much pain. I don't know, and I certainly can't communicate, and I cannot be your educator right now.
We had the trans flag raised here at CAFS for the first time during Trans Awareness Week, and there were supposed to be some stories in that come out which many of us stepped back from, just because of the amount of abuse that came out over that article. And while it's not something that I would do to protect myself, with my eldest going into high school next year, this year in particular, I'm just really wary that my identity can impact their experiences, and that concerns me a little bit with the way that some people are in regional areas in particular, because it's just not as safe as bigger cities. It's easier to hide in bigger cities, whereas obviously being in a small regional town and working where I do, everyone will potentially know my face. So
Even today, I think if I had to go to a new GP as opposed to our shared existing GP that I've had now for 15, 20 years, same GP Chris has now had for at least the last 10 or more years, that creates a certain degree of fear that I don't want to go into a new GP. It's not just about GPs, it's about a day procedure in hospital, it's about having any person in a healthcare setting from surgery through to counselling who does not allow me to be fully my authentic self. Many would say it's my responsibility to be able to just do that. It's your own internalised homophobia talking. I disagree. I've had too many experiences where it felt like my sexuality mattered in the wrong way during the consultation or experience with the health professional.
Being really conscious about how welcoming we make our departments will go a long way. I know so many people that will avoid healthcare facilities because they're so concerned about how they're going to be treated and how their kids are going to be treated, whether they're going to be assumed to be terrible parents because they're gay. So I think trying to make that effort to ensure that these places are safe for everybody coming in and getting the word out there, which is the harder part, because these feelings and these ideas come from previous experiences. It's not something that is just made up in the heads of LGBTIQ families. It's real discrimination that they've experienced and real abuse in some cases at the hands of our healthcare system. So it's something that we really need to try and make a big effort in changing.
That's the thing that makes the biggest difference is I know the placement that I felt most comfortable on. Day one, the nurse walked up to me and said, "Hi, this is my name, these are my pronouns, what are yours?" And I went, "Oh my goodness, this is amazing." And it made a huge difference because immediately, not only are you building that rapport, but you're also showing someone that you're an ally and that you care.
My last GP before my most recent move, he had a little rainbow badge and in his office, and it just made me feel so much safer just seeing that, even knowing asexuality and non-binary, gender fluid, like those things are so often not accepted even when there's a rainbow badge displayed. Even within the LGBTI community, they are not always accepted. But just seeing that rainbow flag, it helps so much. It makes a difference. But it does have to come with an awareness first. Because if you've just got the rainbow badge there and you're still going to be misgendering people the whole time and you're still going to be making microaggressions, don't have the flag until you actually are aware and accepting.
Little things like wearing the rainbow badge, it kind of shows that you're a safe space immediately and you build that rapport with someone from the get-go. It makes such a difference. If someone can feel comfortable from the get-go just by looking at you and go, "Oh, okay, we can talk about everything," you can better care for your patients.
When you put stuff out that people can identify and see themselves in, then it means a lot to them.
Oh, I love it that there's a flag out the front of, there's one at the hospital, obviously, the one at TAFE.
So when attending a medical appointment, it would be ideal to kind of have an all-encompassing option in terms of sexual activity. So when I answer never or not at the moment or no, it shouldn't, there shouldn't be a kind of judgmental tone. And when also asking the question, are you sexually active? Maybe just having it, in that neutral tone as if they're asking the date of birth or their surname. So just, making sure that everyone is included in that option, whether you are sexually active or sometimes or never, just having that all-inclusive.
With forms, avoiding gendered language where you can. So instead of asking for your sex and having male or female, which doesn't cover everyone, having either a fill-in box or having a discussion around it if someone indicates that that's not correct. So for me, with those medical forms, I always just tick both. Yep, all of that, done. I'm gender fluid, so sure. But actually having room to have discussions around it and more complexity around it, instead of just having a digital system where you have got to be either male or female and that's it. Having somewhere for pronouns as well would be really useful. In that gender thing and in that sex categorization, actually having room to expand on what that means. So, okay, this person's female. Do they have a uterus? Is there actually any possibility that they could be pregnant? Is that an irrelevant question to be asking them? Like it's so much more complex than just male or female, especially when you're talking in a medical setting. Those two boxes do not have enough room. They're not useful information most of the time. Even outside of trans people, it still doesn't cover everything.
Your gender and preference of pronouns should definitely be included just for the comfort of the individual.
I would simply say never make assumptions and don't treat everyone the same. For a long time, people have said, oh, you know, they're no different than others, just treat them the same. Well, I don't want to be treated the same as the straight couple because we're not straight, and if you're treating us as the straight couple, you're going to call one of us a husband and one the wife. So that doesn't make sense. You know, just take the time to look at who's in front of you. If you're a brand new health contact for this particular individual, family, single, or any kind of, you know, person, be they LGBTQIA+, and don't forget the intersections. You know, we're not all white or cis. For that matter, someone might be trans, someone might be multicultural, someone might be Aboriginal, differently abled. Just, you know, consider that connecting with somebody, understanding their situation, taking a bit of extra time to read the notes is important and makes a significant difference to the person who is vulnerable, the person who's not in a position of power, that is you.
Like a little board in the room, just a little whiteboard. Obviously it's just for writing medical notes, but most of the time when I go there now, someone will actually write my pronouns up for me. My pronouns are on my medical records, so the doctors know what they are without having to ask me. Some still don't get it. It still causes invasive conversations sometimes, but some of the medical personnel actually look at my file, see what my pronouns are, and just use them. And it's amazing and it's so good, and it's a small thing that just makes a really big difference to make that into a safer setting. So doing that in a GP practice, in a pathology lab, all of those different places, it would just make such a big difference.
Read the case notes. Read the case notes. If someone has already asked a patient a question about their name and their pronouns and you don't read that, and that person has to be asked 10 times or at every handover, if they have to be asked that in the ambulance by 2 paramedics and then at handover and then any shift changes, it gets really exhausting, especially if it's already in their case notes. So if you are writing case notes, put it in there. If you are reading case notes, read them thoroughly, and you can confirm what you read in the case notes just to make sure it's right, but instead of asking the same questions over and over, read case notes.
Don't judge. Talk to them like they're your son or your daughter or your cousin. Like, just treat them like the 80-year-old woman that's there, you know, just for who they are and who they let you know who they are. So if I go, you know, I'm Kelley, I'm a lesbian, this is what's happening, then okay, that's what you are. You've told me that, thanks for that. But what's the matter? Like, actually as just a human being.
Ask questions in an open manner and allow the person to answer rather than you answer for them, or make up your mind what that answer is going to be.
The healthcare workers having more education to not have the assumption straight away.
Well, it's education, understanding, I think, and being around people like us and realising we're not aliens.
Educate those who will directly take care of people, who will potentially be either, you know, unknowingly being bigoted or knowingly being bigoted to someone and, you know, maybe stress a situation, especially in medical care. You are very vulnerable and you don't want to be treated as lesser, especially when you're in a position where you're vulnerable.
There shouldn't have to be an LGBTI champion in any, let alone every health organisation. It should just be standard practice.
I feel like LGBTIQ health education should be in the bachelor degree and the diploma as well, just so that you've got that basis there, that when you come through, it's not going to be a shock to the system. I remember when I was studying, must have been in the second year, and we were doing one of our units, and there was a video that we watched from the Cancer Council of a lesbian couple trying to have a baby, and one of them being diagnosed with cancer, and like, it was a big thing. And then one of the other students went, "Oh, that was a really inappropriate video to watch," and I'm like, "Wait, what?" And she's like, "Well, you know, why should we be watching a video about a gay couple?" And I'm like, "Well, you're gonna be looking after gay people when you go out into the workplace. This is something that you might see, and you need to be aware that everyone's life experiences aren't going to be the same as yours, and that this is something you need to be prepared for." So I think including the LGBTIQA education across the board is probably something that needs to happen.
When we came home, Fletcher was 2.5 weeks old, and I thought, well, we better ring the maternal health and child nurse because they won't know she exists or we exist.
She'd never been to a hospital even in Canada. It was a home birth. So she came back to Australia, never having been to a hospital. And as Chris said, we wanted to connect with our local maternal health services. So we did that, yep.
Yeah, and that was a pretty easy experience actually. They sent someone to your home visit. That was probably the worst of the 4 or 5 people I experienced, and that was just, she was a little, I think, judgmental or trying to correct us in ways, I think, because we were 2 men, but we were just following the advice of our midwives from Canada, who was an excellent service, and we couldn't fault them in any way. But then the rest of the midwives that I had that we would engage with in the centre were great. You know, they read the file before we came in, so they knew Fletcher had 2 dads, and they used great language, and they went through all the questions with me that they normally would. I think there's one bit where they go through a domestic violence situation that they do with women, make sure that they're not stuck in a situation that they still do with me, and said, you know, we normally do this, but we'll do it with you because you could still be in this situation. And yeah, I can't really fault them. Fletcher's due again in another month to go back, and we've only been to the hospital once with Fletcher, where she had an overnight visit, and that experience once again was great. I don't think we had any issues. They just said there'll be another guy coming that will say she's her dad. She has 2 dads, so if someone, you know, let the staff know in case the person's not on the desk that I spoke with, and they go, but her dad's already in there. And I don't think we had any issues coming in.
No. But again, this is more recent, so Fletcher's not even 3. And we mentioned GB Health earlier, which is Shepparton based, and over the last 15-20 years that I've been there, in my variety of roles, and through the leadership of GB Health, they've taken considerable steps in becoming more inclusive. So although we had that, call it a mishap with the maternal healthcare worker who felt we were...
she was a little older too, when the other ones that we never met were quite young as well, so whether or not it was just that attitude.
Generational thing, the attitude, yeah. And so for me, the takeaway there was that they had a form. Normally the form would be focused on asking women if they had had issues around domestic violence in the current relationship. They stopped, they thought, can we use this in an appropriate way, and is this right for the situation? Yes, it is, let's proceed. So it's about, there we go, a conscious thought about being inclusive and whether this is the right way to do it or not, and then taking action. Not going, oh, this is for women, let's leave it off. You know, just because it's a woman on the form. So it's about understanding there are systems and frameworks and protocols in place, but sometimes that needs to be reflected on in the moment. Be very careful, please, Fletcher, of the camera, and being inclusive with your practice in a way that affirms the relationship and the rainbow family, if you like, that you're working with. Yeah.
So because we felt that we were limited to how we could conceive, like through IVF or any medical situation, we thought we would start privately. Privately worked out well, and our GP was very supportive. So going back to GPs, she didn't bat an eyelid to help us with what we needed. And then the only time that we had a little bit of a stumbling block was about the birth certificate, and the biological father didn't want to be on the birth certificate, so we needed to got some GP help there as well. So that's why she's made it, to help us with what we needed to do, and helped us with that as well. So that wasn't going to be an issue for it. It didn't turn out to be an issue, and we were able to just have myself on the birth certificate. Belinda wanted to be on the birth certificate, but I was going to say 20 years ago, but 13 and a half years ago, she couldn't do that. Couldn't be on the birth certificate except for an informer. I think the main one was going to be the birth certificate, as you mentioned, and whether there was going to be any issues when I was in hospital having a baby, if there's any medical situations. But they assured us, at the hospital, to be asked, that wouldn't be an issue as far as any medical decisions that needed to be made.
If you couldn't make it, then I could make it.
Yeah. Yeah. So our GP was very supportive, because practically didn't discriminate against us by the choices that we were making of wanting to have a family. So at no time was she talking about us not being able to do it or shouldn't be able to do it or anything. Anytime we had any questions, she was happy to discuss that with us.
Yeah.
So that's the support that
And
we
just
had.
normal pregnancy talks, I know this is normal, this is not, this is,
Yeah.
trying to get pregnant, this is what to look for, is, this, whatever.
Yeah.
Whatever came up, so she was good with that.
Because it wasn't a big deal.
No,
Okay.
and because we've known it.
Yeah,
for
yeah.
a long time before.
And again, we didn't just rock up and serve the first time and said this is what we wanted to do. She'd been our GP since we moved to Wangaratta, so that's over 20 years ago.
No, 7 years before that.
Yeah, so long time. It's 20 years. Yeah. So, she's the first doctor we saw when we got here.
Yeah.
So, I think again that helped.
Yeah.
We can't speak for people that are coming, to a GP for the first time and having that kind of situation. But in our experience, it was
And even when we
fine.
even when we went to the birth classes and because we were with the community midwives, nothing. Like it was fine. It was just like, yeah, cool, that's fine. And they were there and obviously talking to us on the day. We had our Janet who'd been with us the whole time and stuff like that. And it was just like, cool. So we're gonna get this baby out. Like that's just that was kind of.
But there was such a variety of people there. That
it was doctors and nurses,
but single parents.
Oh yeah,
that's what I mean. Like
birth classes.
as a birth classes, and that we were not the most different or the most unusual, or not everybody was just
the married couple.
The married couple
that's
is
true,
man and wife there. So that's it. Anytime we thought that we might have had a barrier, we didn't. So, and that's because of the people we've come in contact with, starting with our GP and everybody that we've met at Northeast Health. We've only had good experiences.
Yeah, sure.
So this is not all about Debbie Downer stuff. This is also about the good experiences that we've been able to have.
Audiologists and lots of different people, and surgeons and.
That's it. Ava's been to hospital a few times.
Been there a few times.
So in all those, it's hard for me to just because I wouldn't have got that anyway. Like it's more for Belinda to speak to that. Did she ever feel, sort of left out or not, not heard, or in all of the times that we've been to the hospital? And I don't think that we ever have. So. We are very thankful that even if we're in a country town that's not supposed to love gay people, we haven't had any problems. And that's a good thing. So that shows that there are people that are accepting. So just keep doing what you're doing and just learn the new stuff.
Yeah, that's pretty much it. That's what I got.
Where I currently work at the moment, I think that people are constantly trying to make an effort to make sure that they get things right. There seems to be this fear of making a mistake, and I try to let them know that making a mistake is something that we're all going to do. Like, we're only human. We make mistakes every day. If you make a mistake with a patient, most of the time they're not going to be too bothered by it if you just say, hey, sorry, and move on. Again, it's that intention. So I find at work, most people, their intentions are in the right place, which is what matters. And I find that they're constantly trying to improve what they're doing. And a lot of them are really keen to have more education, and they've often approached me going, hey, when are you doing your education session? I really want to be there. And I feel like that wanting to learn is the first step to making an inclusive workplace.
I'm glad that we're actually having something like this, and I would say I'm relatively new to the LGBT world, and I think there's lots of factors in it as well, and it's good that we as people in healthcare deal with the most vulnerable in society, and they come to us for the care as well. So I think it's really important to get to know the person behind the sexuality. Oh, hello, how are you? The little friends joining us, and get to know the person behind the pronouns. And we're always going to have biases. It doesn't matter if you're Mother Teresa or whoever, you're going to have a bias. So just acknowledging those things, and it provides better care. And I'm really glad that there is this forum where we're able to express those things and get perspective from all over the place. Thank you.
No, thank
Be open to learning. I think that's the biggest point that I can put out there, is that as healthcare workers, we're constantly trying to improve our practice. And this is one area that seems to get overlooked quite a lot. So just being open to learning about LGBTIQ issues within the healthcare system is a great first step to improving healthcare for all of us.
So just keeping an open mind that everyone's different and has different priorities and feelings and personalities. So when answering never or no or whatever the answer may be, just being open-minded as to have no surprise, and then just move on to the next question.
If you know that your colleague is doing the wrong thing, or that your co-worker is doing the wrong thing in some way, is using microaggressions, is deliberately misgendering a patient when they're not in the room, call them out on it. Don't just let that slide, because it creates a toxic environment for trans people like myself, and we don't get the medical help that we need. And that's because of that bullying and harassment and transphobia that we do encounter in the medical field. And it's not good enough to just not do that. You have to call it out when you see it.
I would just say, leave off by just saying, just have respect for the person that's in front of you, regardless of who they are, what gender they are, how they, what their sexual orientations are, or whatever. They're a human being. They're there for a reason.
It's okay to have bumps where you screw up, because everyone adapts to this new world of, people changing their sex and possibly changing their identities, changing their sexuality. It's okay to take your time with understanding this, so long as you do it with an open mind and an open heart, because these people aren't changing themselves, or they aren't being these things from a place of malice. They're just trying to live a happy life. That's pretty much it.